everybody.
Good morning.
I don't usually get up and get functioning this early for anybody, but you're that special today. What I'm here today about is to introduce a group of people that I'm very honored and proud to know. A few weeks back, or months back, we applied for a program that is near and dear to my heart. There is a group of people at St. Vincent's medical group. It used to be the care group, which was a big cardiology and cardiovascular aspect or division of medicine here on the north side. They have a program where you can apply for a grant of an AED, which is an automated external defibrillator. When somebody has a heart attack, that's what we use to restart the heart. These are very, very expensive pieces of equipment, and with university growing, and we have two different buildings, we only have one. So as you all know, I'm a little bit of a control freak, and I always like to keep my AED, or the one that's supposed to be in this building, it's not really mine, here in this building because of all the athletic events. Well, Murphy's Law would indicate that there's always another building, so if something's going to go wrong, it would go wrong in the other building, and the AED's over here, not over there. So logistically speaking, that's a nightmare waiting to happen. So we applied for this program, this grant, and we were very graciously honored to be a recipient of that AED. I'm going to tell you a little bit of facts, not a lot, and then I'm going to introduce the kind people from the medical group. Most of you probably don't know that over 400,000 people each year die of what is considered sudden cardiac arrest. It's commonly referred to as SCA. SCA occurs abruptly and without warning, and it can happen to anybody, anytime. Many people without any indications whatsoever. You don't have to be fat, old, and have horrible lifestyle. It can be anyone, even young people. The survival rate of people that have SCA is not very high if not given resuscitation via an AED within 4 to 6 minutes. We're excited at this point to introduce Dr. Girish Nair. Oh, I did it. Nair. It's a lot of vowels in his name. An electrophysiologist from St. Vincent's Medical Group, and Cynthia Carty, who is a director at the St. Vincent's Heart Center of Indiana and Heart Emergency Unit. With us today, they're here to make the presentation to the AED to our school. I'd like to ask Dr. Nair to come forward at this time.
Thank you, Chris, and good morning. Thank you for having me here this morning. I wanted to talk to you briefly about an AED and sudden cardiac arrest. And one of the stories I wanted to share with you is of another high school student from a few years ago by the name of Austin Tabor at Franklin Central High School. And Austin was actively involved in school. He was looking forward to the last day of school. This was like the end of June or end of May. And he went home, and at home he had sudden cardiac arrest. And what that means is that he collapsed suddenly, his heart stopped. Cardiac arrest is something that can occur to anyone at any age. It's different from a heart attack, which is a blockage in a blood vessel, but what cardiac arrest does, it's a short-circuiting of your heart when the bottom big pumping chambers don't pump anymore. And that can happen suddenly without warning. And what he was lucky to have, Austin, was that there was an AED immediately available, and they were able to defibrillate his heart and stop the cardiac arrest. And as Chris mentioned, this is something that's very vital, is implemented within 4 to 6 minutes. And this saved his life, and he's now enjoying a very happy life and I think graduating high school. An AED has the ability to recognize your heart rhythm. When someone has cardiac arrest and you have a device like this available, you place those pads on the chest, and it will kind of guide you through and tell you what you need to do, if you need to shock or not shock. And so this is not very difficult to use, and anyone can use it with a little bit of training. And I think it's vital that all schools have these devices in all public places because this can save someone's life. And if you have delayed treatment, it can actually impair their quality of life, because the longer you wait to shock someone if they need it, the higher the risk of brain injury and other problems that can't be solved afterwards. So it is our pleasure to provide all of you with an AED or a second AED. In fact, this is something that can occur that you may see happening in other people. You may have heard about the basketball player Hank Gathers many years ago, who's collapsed suddenly during a basketball game. And this is something that happened even as of yesterday. In the news, there was an Oregon State football player who was playing pickup basketball, and he collapsed suddenly and unfortunately died. There was no AED available. If there was one available, it could have saved his life. And so it is very important, and in terms of treating sudden cardiac arrest in all patients and all people in school and at all public places and venues and sporting events. The Reviving Heart program that is administered through St. Vincent's provides training to all schools in terms of the use of AED. And I think once all of you have a little bit of training, it is something that anyone can use and use effectively to save your friend's life, family member's life, or someone that you know very closely. At this time, I'd like to introduce Cynthia Carty, Director of the St. Vincent Heart Center in Indiana Emergency. Thank you.
As he said, I am Cindy Carty, and I do work at St. Vincent Heart Center, and I am very excited about being here because I'm passionate about the delivery of heart care. And I'm very excited that St. Vincent Heart Center, where I work, another place that I call home, has been part of the sponsor behind this AED that you're receiving. With an AED, every single one of you, every student, every faculty member, every visitor, every athlete, every spectator that knows that they have heart disease, and every spectator that doesn't know that they have heart disease will be safer here. So University High School is a safer place, and I am very honored. I have been a cardiovascular nurse, a heart nurse, for almost 30 years. And I can tell you that over those 30 years, there's been tons of changes. I teach basic life support, how to compress on the chest. I teach advanced life support, how to add the drugs, how to add intubation for when someone is not breathing. But what we've learned over the years is that that basic life support is what saves lives. And the AED is considered part of that. I ask that when you leave here, that you talk to your faculty members and find out what is your part, because the AED, it's very simple now. 1, 2, 3, open the box, put it on, turn it on, stand back, let it work. But more importantly, if it sits in a box, it doesn't save lives. Students, you are the #1 group in this room. Your knowledge. I encourage you to step out of here. Go to websites. I hear you're very intelligent. You're independent learners. Go to the website. Go to AHA, the American Heart Association.org, and find out where you can take a basic life support class. You need to have a plan. Not only do you need to have an AED box, you need to have a plan, and that plan needs to include recognizing when do you need the AED. People don't arrest in the hospital. They do. But more often they arrest airports, malls. How many of you like to go to malls? Malls, churches, sports events. How many have you read articles recently where people were at sports events and have a plan? So you need to have a plan, recognize the symptom. When does someone need that AED? Immediately stop, think, call 911. You all carry cell phones. Yell for an AED, get it placed, and I encourage you to learn basic BLS, which is the chest compressions. The American American Heart Association says that all of us can save lives, and I ask that you do that. I'm very proud that St. Vincent Heart Center has been a sponsor of Dining a la Heart. And Dining a la Heart is a program that subsidizes and helps fund reviving hearts. And without that, we would not be sitting in here in this room, you receiving an AED, and me begging you as a healthcare provider to go the extra step and learning how you can intervene. Thank you. Thank you for your time. I hope that this will be a changing moment for you, because I can tell you it changes my moment in my life every day. Thank you.
This time we'd like to have Jamie Napier, Assistant Headmaster, come over so we can present you with the AED.
So just on behalf of University High School, thank you to St. Vincent's for giving us this and making everybody safer. So I appreciate that. Thank you so much.